And we're back here on 6 Degrees of Associations. I am joined today by our friend Alan DeYoung. He is the CEO, Executive Director with the Wisconsin EMS Association. He comes to us by way of our friend Russ Webb, who is the Bay Area, Florida, that's the Bay Area in Florida Departments Association. I always like to throw that in because people think Northern California when they hear Bay Area, it's actually down in the Tampa region. But Alan, welcome to the show. Why don't you just kick it off and let us know how you know our friend Russ Webb?
Yeah, Russ and I actually met both being Novi EMS customers, and we actually sit on a council together to really talk about association needs and kind of addressing the kind of ever-growing and ever-changing world of associations. So I've gotten to know Russ over the last few years here, and he's a fantastic individual, has lots of great ideas, and really pushing the limits, especially for like a regional association doing amazing things. So I love getting his insights. I just talked to him recently about our exhibitors and such, gave me some fantastic ideas.
You know, and doing some research for this episode, I was reading all about Wisconsin EMS Association, and I do want to ask you some specific questions about what makes it a unique association among its peers, and we'll get into that in a little bit. But in your own words, just tell me a little bit about the Wisconsin EMS Association. How many folks are you serving? And let's start there.
Yeah. So Wisconsin EMS Association has been around for just over 50 years. So since what I say is the inception of EMS in the state of Wisconsin, literally EMS became a profession by law in 1972, and our association was created in 1973, so just immediately after. We serve around 5,500 or 6,000 members across the state. Most of those are your typical EMS agencies, so it could be a fire-based like your fire department down the road, or it can be a standalone EMS that we see, could be a district, countywide, all sorts, and we represent them throughout the entire state. And so we provide everything from, of course, membership benefits, our training, so online education, as well as annual conference, and most importantly, advocacy.
One thing that jumped out to me about the Wisconsin EMS Association was you're actually technically the largest state-level EMS association in the United States. Now, Wisconsin, I'm not the greatest geography wizard here, but Wisconsin is not the biggest state geographically or by population. So curious how that actually came to be.
Yeah. So I think it was really just, again, since the foundation and formation of the association, really being super active, especially on the advocacy side. So we've gotten a lot done, and Wisconsin has been kind of at the forefront for EMS as an industry. So our membership has grown over time, and we've been kind of at that level, right now, especially we've seen a lot of consolidation amongst the industry. So being able to maintain that same representation and that same level of representation is critical, and it keeps us being the largest, at least state level organization for EMS, representing them across the entire country. So we're not a huge organization. We have just 3 full-time staff, but a very active 12-member volunteer board of directors. And just a very active membership as well that get active with not only the education, but definitely our advocacy.
We always ask this question on our show here, 6 Degrees of Associations. How did the world of associations find you, or how did you find it? What is your background on how you found us and what keeps you in this industry?
Sure. So my background, obviously, there's not a nonprofit or anything like that. My background was in IT. Then I ended up doing a master's in marketing, and then at that point, actually found myself in a role as sales and marketing director for the Wisconsin EMS Association, WEMSA as we're known. And I kind of fell into this not knowing really what EMS was, like most of the public. You generally understand what 911 is and then medical response, but not really having that full comprehension. And this was really, I say it's kind of due to a mishap. So in 2018, I slipped on ice, like we have lots of ice in Wisconsin, slipped on ice, broke my leg. And that was one of my few interactions with EMS, but not knowing that literally months later, I would end up working for the association. Um, but I ended up starting in sales and marketing, and then in 2020, so late 2020, actually was promoted to executive director and have been ever since. So
Wow. Well, I'm glad you're okay. You must have been a scary situation there. Anything else you want to tell us so we're not kind of still worried about you? Everything ends up okay with that?
yeah, I mean, it's one of those, obviously I say when I fell, my leg wasn't pointed the right direction. But it was the dead of winter, and um, it took many individuals to get me off the ground and get me to the hospital, and they put it back into place. And a couple surgeries later, I was walking again. That's a simplified version of it, but
Yeah.
that really became kind of a defining moment in my life as well, just because I went from, breaking my leg and I was very, I will say, out of shape, and it made it worse. And so in 2020, I went on a weight loss journey, if you will, over the last 5 years here, losing weight and really turning around my own personal life, as well as then really getting involved way more on the EMS side of things. So not having an EMS background myself, I will say I sort of take like a pride in that, just because I want to be the representation of our members and not have any bias within the industry itself, just to ensure that we represent our members, and I do that as best I can. And so I want to understand the industry, but I also don't want to be biased in the industry. So that launching point of my interaction with EMS from as a bystander, as a patient, to what it is today has really kind of been that foundation for me in wanting to serve and learn about EMS.
Yeah. And I mean, your story kind of describes how important it is. Then the level of responsibility you have representing a group of professionals that literally their job is life and death, and the education that your association needs to put out there, literally having life or death consequences to it. Is there anything you want to speak on behalf of having that amount of responsibility and what your day to day is?
I mean, I always say it does get stressful from time to time, but I find a lot of passion in it, because EMS is one of those things that you don't really think about until you need it. One of those services you don't know when you're going to dial 911, and but when you do need it, it is one of those. Could be the worst day of your life. It could be the most defining day of your life. Um, my accident breaking my leg wasn't the first time I encountered EMS, but it definitely was a defining moment in my own life. And so I kind of that's where a lot of my passion stems from, is as most individuals, we need that help. We dial 911. We expect them to arrive. We expect them to provide the best level of care possible, and not just transport, but treat and transport to the hospital. And that is kind of the ever-changing industry of EMS, of what is it defined. And so my role has been, how do I best support that on a statewide scale? And because of course I live in Wisconsin, I've got family here, I've got kids and everything, and I want to ensure too, if I ever need it, I want to make sure it's fully funded, fully supported, and making sure that they're able to arrive, not just for my own personal family, but everybody else that I know. And that should be pretty universal across the board. There's an expectation when you dial 911, they're going to be there. But EMS, by not only state law in the majority of states, but even by federal law, is not an essential service. So that's the biggest piece that people thought, especially during COVID, is, well, EMS is essential, of course, right? It's essential. It's not. And some states have made it essential, but not all. And that's part of our journey too, is making sure that people understand that this is something that has been predominantly volunteer, and predominantly, I would say, subsidized by the volunteerism. And we need to start moving towards, hey, we expect this service, we need to pay for this service. Um, and it's something foundational to the basics of a society, of public safety. That is your foundation to exist. And so we need to be super supportive of that as a community, especially as a state, to make sure everybody's protected.
No, I could definitely see the value of having a state association dedicated to EMS. Obviously, being the state capital, Madison, you want to get things done at the state level because there are really important issues that need to get, for lack of a better term, done at the state level. So, what's the relationship with the national association that your members have? And is there a relationship there with coordinating kind of federal legislation that needs to get done, or any other reasons why members would also want to be potentially belonging to that national association?
Yeah, I mean, I think we both kind of, at each organization, both state organizations and federal, national organizations, kind of attack things differently on, what is most likely to get passed on a federal level versus the state level. So there is coordination between the two, but states have a lot of that kind of home rule power, especially in Wisconsin. We literally have what we kind of refer to as home rule, where municipalities make a lot of their own decisions. It doesn't come from typically a county level or state level. And so we focus heavily on what can we do on a state level to really support EMS. We'll look at the federal side of, we really don't get involved too often, but in case we needed some sort of federal change, we obviously coordinate with the national associations for EMS. But a lot of EMS advocacy work definitely gets done on the state level.
Yeah, there's no question about it. And I'm always curious about what the benefits are to a member for being in a regional association versus the national one. We talked about the legislative piece. What else is there that is beneficial when things are hyper localized? Being a member of a professional organization.
I think I've seen this definitely more of the last year or two, is that local involvement. I mean, more individuals are kind of tuning into what their state laws are, what their local ordinances are. They're starting to go, hey, who's making these decisions for us, and how can we get involved to help guide those decisions? So we've seen a huge push with our members locally to get involved, not mainly a lot of times with our association, to be those local grassroots advocates as well. And then, of course, our association acts as that state voice across the board. I always say I don't want to represent one voice in the room. I want to make sure we represent, all 300 plus of the EMS agencies we represent as they're serving the community, and then also take that public standpoint as well. So trying to educate the public as much as we can on this issue, but then get our members involved. So that's a lot of why members will want to not only just be a part of the association, is being part of that voice and being involved in that advocacy piece, both on state and their local municipal level. But then also just kind of understanding it as well. So EMS is changing from what it was of, hey, we respond and we transport as soon as we possibly can, to actually more calls are going to be treatment in place. So we're going to treat the patient there on scene, and maybe we actually don't have to transport them. And that's a kind of a flipped concept of always transport, get them to the hospital. When a lot of challenges and issues can be addressed on scene, and that's where our members have been involved on kind of the scope of EMS. What is EMS from what it was 50 years ago to what it is now, and our understanding of how do we continue that change? Because I say EMS is kind of bringing that doctor back into patient's home. Now, we don't have doctors all the time, but we have highly trained critical care paramedics, or even just paramedics that are highly trained. It's not an easy route to become a paramedic. It's very skilled, and your scope is very vast. And so there's a lot of new programs, both treating the trauma side of things, like bringing whole blood into the field, to more community medical services, especially when we see healthcare systems kind of being fragmented across different regions, especially rural areas. Well, most patients then are dialing 911. So they need that community medical services piece of it. And so we're driving that aspect as well because EMS is becoming their healthcare kind of services all around. And so kind of addressing the needs of our community, both on the emergency side and just your day-to-day healthcare side, is how EMS is kind of reforming what it is as an industry.
Definitely. And I'm curious about your annual conference, the state EMS conference that you hold. What keeps people coming to that, coming back to it? What kind of comments are you hearing about the value that people get out of coming to that? It makes it easier that it's in state with easy local travel. But aside from that, what kind of other reasons are people loving that conference?
Yeah, so our annual conference has actually been around for over 40 years now. So it mainly has been hosted in Milwaukee, but we moved it to Green Bay, just new location and a great venue to work with. But the main reason people keep coming back to our conference has been more so the experience overall. So as an EMS provider, you need to relicense in your state, and sometimes you also renew your national number as well. But really, that relicensure is important. So continuing education credits is something we provide, but we know that's not like the main reason people come because like a lot of education in different industries, EMS education is a bit of a commodity. If you want cheap continuing education credits, you can pretty much get them anywhere. But if you want something that's, like I said, the newest, the most innovative, or really that connection and networking of, hey, what's the better way to do this? That's where our conference comes into play, both from a management level and then all the way down to the field providers as well. We try to cover that entire gambit. So with our expo hall, and we do multiple days, multiple tracks, and our conference has really grown over the years. Like it kind of reached a peak point many years ago, kind of came down a bit, but now we've kind of grown back up again, and it's really because we kind of build on that all-inclusive attendee experience from both, hey, you're going to learn something here, you're going to network with people, and you're also going to have some fun, getting away from your normal community out with other peers as well, and just having a good time, but still maintaining that educational component is a key principle. So
Yeah, it sounds like you're getting a lot of feedback on the social aspect of it, which, obviously there's networking benefits if you're trying to maybe make a career move, something you meet so and so who works at a place that's hiring or something like that. There's always that angle. And then there's, of course, just talking to someone who's going through the same kind of struggles that you are that might not have the same, stake in the game as like maybe talking to your boss or something about the issue. Is there, is there a significant social component that you build into that conference?
I would say a lot of the networking is done with not only we bring in national speakers and local speakers. We always like to have a nice core mix there, but it's done a lot of times in those classrooms. So that's probably the biggest piece of the networking is getting some of those answers to your questions right from those national presenters, those key stakeholders, or just from peers that you say, oh, I don't realize that, you might be across the state or even from another state, then you do things a little bit differently, and that might help us solve the problem that we're having here. And so I think that's kind of the key piece we bring in is that you don't need to have a mixer, that you're forced to network with people. It's like, let's have a common topic within this session that brings out additional questions, that brings out some of those better answers and solutions that we're looking for. And then, of course, like I said before, everything's changing in EMS. So we need to keep continuously keeping up with that. And that's a big piece that wasn't previously required is that compliance, that operations, the business aspect of EMS. We're taught as clinicians, you're taught how to save somebody's life, but not how to run a business. And even though our members are majority government, municipal based EMS, that is still a business. You still have a budget. You still have operations and compliance pieces that you have to abide by and ensure that you're doing day in and day out. Grant programs, you have to understand how those work, how to manage those properly. And so there's a lot of complexities to EMS that didn't exist before that we bring those individuals together at the conference and kind of let that networking piece socially happen during these different sessions and in between as well.
Yeah, definitely. And as a association professional myself, the thing that really appealed to me when I worked at the American Urological Association was the fact that I get to wear so many different hats each day. I mean, that really appealed to me. I don't love the routine of doing the same thing every single day. So, it's just the way I'm wired. But is that walk me through the day to day of your team and your specific day? I mean, as a team of three, I'm sure that there's a lot of different hats that you all wear.
Yeah, definitely. I mean, obviously, team of three and tackling the number of not only members that we have and be able to support all of them, but our annual conference being one of the largest EMS conferences in the country, that is a huge undertaking. And then we want to be as active as we possibly can in advocacy. So me personally, my role has focused on advocacy. I'm a registered lobbyist exclusive to the organization. My day to day has anything from we go out and visit our members. So I noticed this is something that is starting to be more unique that not every association is able to do or has done in the past. Is since 2021, after I became executive director, we said, hey, we should probably start visiting our members face to face. And that has just ramped up over the years. So I mean, just earlier this week, I was visiting one of our members before one of our chiefs, just to really go through their questions right in person, get them answered. So a lot of times it's traveling around the state, not only just for meeting our members where they are, or even non-members. We meet them both anywhere, as well as now we're not in a legislative active session right now, but we will be. Typically, when we are, I will travel to the Capitol and talk with legislators or be testifying at hearings and things like that. But then I also handle a lot of our financial operations, day-to-day operations, of course, and I dabble with having an IT background. I actually have helped create our own speaker portal. So that was one of the big things. So I developed our entire speaker portal, the submission process, the review process to meet national accreditation standards, and working on a lot of other, I want to say, like IT focused projects, our conference itself, in order to really, I don't know, we were told we were the gold standard of EMS education because of many of these processes we put in place regarding our education, especially for conferences, for our conference itself. And so that process was also built into that speaker portal, but we do session evaluations like most do, but providing live reports back to our speakers too. So they get a full-blown report of how they did in different categories, how they were rated, open comments, feedback, and things like that we can review then internally, the speaker can review, and then we can build upon those when we look at further education, whether it's webinars, whether it's the conference, whatever it might be, and really continue going from there. And then, not to add to that, but we have done a ton of grant programs over the years. We get heavily involved with other organizations, whether state or federal grants for different types of projects. So one recently that we are working on is actually for establishing student emergency response teams in high schools, because we know that that's where the kind of career exploration starts, is that high school timeframe, but also knowing that, hey, if we have more day-to-day providers that just they're bystanders in the community that can respond to somebody that they're having a heart attack, a stroke, a seizure, and knowing how to respond appropriately, and then being able to hand that off to EMS makes that flow so much better. I mean, everybody talks about hands-only CPR and how important that is. Well, imagine if every single high school in your state had its own student emergency response team of 10 to 20 students that were able to respond to emergencies on your school campus.
Now, there's a lot of that gold standard comment does not come as a surprise. There's a lot of amazing examples of why Wisconsin EMS Association is. It's an example of what a really amazing, high functioning state association can do. And I appreciate you taking the time to share a lot of that inside talk about what makes the Wisconsin, EMS Association so unique. Alan, I wanted to ask if there was someone in your network that just amazes you in the association space, inspires you. Russ Webb introduced us to you, and as the nature of the 6 Degrees Association podcast lives on, I'd love to know if there's anyone that you think that we should be talking to.
Yeah, I can think of a couple of people actually. So one is Nathan Victoria. He's the executive director of the Society for Personality Assessment. He's really always wanting to do the most for his association, trying to always look at what other people are doing, trying to keep advancing that as much as he can. And so I think he'd be a great one. Another individual that, although is not directly association professional, but I still want to make a big shout out to Pete Zimick. He's the CEO of Novi AMS. So obviously as an association, we've used a lot of software, especially over time. We've changed software so many times. I have never encountered a CEO that is more hands-on than Pete is with any idea. Being able to, not only just to, hey, acknowledge that a customer had an idea, but taking that to the next level and seeing how we can solve these day-to-day association challenges with a software company and being there directly for the associations, not for some, third party or private equity or anything like that. So I really want to give a shout out to Pete because I think he'd be a great individual to interview. And then my third one is actually Heather Sherrar. She's the executive director of the Ambulance Association of Pennsylvania. So I've known her for many, many years and has been at the forefront of really advocacy for EMS in their state and has done quite a bit for their members across the entire state as well.